Professor Gavin Jack from Monash Business School, and today I'm going to be talking about a collaborative research project that seeks to make a positive difference to the health and safety of street food vendors in India. Through its research agenda, Monash Business School is committed to building thriving communities, and one way that we do this is by funding research that seeks to have real impact, supporting our researchers to work with partners across the globe to tackle some of the world's biggest challenges. The Street Food Project is partly funded by a Monash Business School Impact Acceleration Grant, and it tackles a critical health issue, that of food safety, that also has significant economic implications for one of the world's most populated nations. Monash's Dr. Denny Tomasi has been working with Sudipta Moitra from GUP, a Kolkata-based NGO, and Marie Pullman-Larsen from the Danish organisation Innoaid. Sudipta, can you tell us about the situation of street food vendors in India and how your organisation works to support them?
Thank you, Gavin, for the excellent opportunity. Street food vendors are a common sight on major Indian streets. In Kolkata alone, there are more than 150,000 street food vendors providing affordable and nutritional food to millions of Indians every day. But street vending is still an informal occupation, a situation that creates many challenges. Vendors usually lack basic infrastructure such as water supply and toilets, as well as knowledge and awareness about food safety, which creates significant food handling waste. As their work is informal, they fear crackdowns from authorities, limiting their ability to make investment in their business that may improve these problems further. For a number of years, Indian government has attempted to tackle this. In 2014, Indian government passed the National Act for Urban Street Vendors, which aimed to introduce regulations to improve food safety and hygienic standards. But so far, these efforts have been limited to a few urban areas. My organization, Gaur Unnayan Porshod, has been collaborating with these street food vendors to understand how to tackle these challenges and to improve the lives of both vendors and their consumers. Thank you, Gavin.
The other global partner is Innoaid. The Street Food Project is one of Innoaid's development projects, implemented in partnership with GUP and initially evaluated by a team including Dr. Tomasi. Marie, can you tell us what you sought to achieve with this project and how you encountered some unexpected results?
Absolutely, Gavin. So, simple trainings is showing to be a good way to increase knowledge, awareness, and capability to deal with food safety risks. This is why my organization, Innoaid, together with GUP and 3 economists from Europe and the US, conducted a randomized control trial in Kolkata to test how effective a training program was. We studied 900 vendors and identified that training substantially increased the vendors' knowledge and safety awareness, but there was no real impact on actual food safety behavior. The reasons we uncovered was that information alone does not reduce the cost to produce safer food, and customers found it hard to detect contaminated food. So there wasn't an incentive for vendors to change. So what is needed as a next step is investment in infrastructure, while at the same time increasing consumers' awareness about safer food.
Finally, Denny, you did the initial impact study for the Street Food Project for Monash Business School, and you're now developing this work for future impacts. What are the next steps for you and the team at GUP and Innoaid? And importantly, how would you like local policymakers in Kolkata and elsewhere in India to get involved so they can make a positive difference for the health and safety of street vendors?
We plan to build on the results of the first project to produce new knowledge about what works in this sector and what does not work. What we have in mind is an intervention with 3 groups of vendors. One group will be randomly assigned to receive some infrastructure, such as clean water every day. One group will be randomly assigned to receive some incentives to help customers increase their ability to detect food safety. And one group will form the control group, and they will receive the same incentives, but after the data collection is concluded. Then, for 6 months, the idea is to monitor food safety practices and other economic outcomes of interest. Among other things, this idea has attracted the attention of the FAO, the Food and Agriculture Organizations of the United Nations. By understanding what actually works, we aim to give precise recommendations to governments about how to implement the 2014 Act.
Thank you, Denny. And thank you to you, Denny, Marie, and Sudipta for talking with me today about a Monash Business School project with potential for great impact. I do hope that policymakers can take up your recommendations and make a difference. Thank you very much.